The state laws regarding HIE contain two requirements of participating providers. Number one, the first time a patient visits a participating provider after connection to the HIE, the patient must be notified that the provider participates with the HIE and offered a state-approved opt-out form. This is generally done during the registration process and takes on average 15 to 20 seconds. Most patients will decline the form or take it with them. If they do decide to opt out at that time and ask that the provider send HealthInfoNet the form, the provider must get it to HealthInfoNet within 2 business days. HealthInfoNet provides new participants with a number of communications tools to assist with talking to patients, employees, and other stakeholders. Patients are also welcome to call HealthInfoNet as well. The majority of patients want their information available in the HIE, and currently only 1% opt out. Some patients have a number of questions, which are generally easy to answer using the talking points and FAQs provided. There are a few that have extensive questions, and HealthInfoNet always recommends that providers have a plan to both ensure the patient gets their questions answered while not slowing down the flow of patient registration. We've generally found that the better the explanation, the less patients opt out. However, participants should be careful not to try to convince the patient either way. Give them enough information in order for them to make an informed choice, whether to remain in the system or to opt out. Let's hear from some registration staff at some of our participating sites.
A lot of them think it's a really good tool because most people, especially up in the Bangor area, are traveling down south. And so, especially people that have major medical conditions, if they're not able to speak for themselves, they think it's awesome that, someone will be able to look that up.
I would say, for instance, I have a drug allergy. If I'm unconscious at an emergency room, I want them to know that I have a drug allergy. So I use that as an example if somebody's on the borderline, not sure what to think of it. I said, but I understand both sides. Again, just repeat my explanation and give them both the explanation as well as the opt-out form so that they can think about it after they've read through.
I spoke with one patient who had opted out, then was seen in the ER and opted back in. And I did explain to him when he does that chunk of time that he opted out and then when he opted back in is gone and it can't be found again. So there's that little piece missing. But patients when you explain it that way to them, it's helpful to them. It's helpful in the need of emergency. They seem to come on board with that.
Here are the questions most frequently asked by patients and the corresponding concerns. These questions and concerns are addressed in the talking points and FAQs provided. But quickly, the point of HealthInfoNet is to improve care coordination. Information is not searchable on the internet. A patient's personal information will never be sold. And lastly, only providers have access to this system. Thank you for listening to this tutorial. For more information, please visit www.hinfonet.org.